Imagine if a tiny patch on your arm could predict the next pandemic before symptoms even show, not just for you, but for your entire city. What if that data could travel instantly to a global health dashboard and flag a warning, days or even weeks before hospitals start filling up? That's not science fiction. That's biosensors, and they're already transforming how we detect, respond to, and even prevent outbreaks. The real story here isn't just the tech, it's the system, a new kind of global immune system built on sweat, saliva, and smart algorithms. Let's decode how it works and what it means for the future of health on this planet. Chapter 1: The Sensing Revolution. A few years ago, the idea of diagnosing illness without stepping into a clinic seemed impossible. Now, you can stick a sensor to your skin and it quietly listens to your body. It tracks your temperature, heart rate, hydration, glucose, lactate, even the chemicals in your sweat. No pain, no blood, no hospital. This shift didn't happen overnight. It started with wearables, fitness trackers, smartwatches, patches. At first, they just counted steps and measured sleep, but engineers and biologists pushed further. What if the same devices could sense biomarkers, molecules that signal inflammation, infection, or even stress levels? Now, we have biosensors the size of a coin, made from flexible materials that mold to your skin. They continuously collect and transmit data. Some use Bluetooth to sync with your phone. Others send data straight to the cloud. You wear it, forget it's there, and it keeps watching, not just for wellness, but for danger. Here's where things get interesting. These sensors don't just work for individuals. When deployed at scale, they form a dense network of real time health data. Think of a city where thousands of people wear biosensors. If even a small cluster shows signs of rising body temperature or elevated respiratory rate, that data becomes a pattern, not random noise, but a signal that something could be brewing. This is how biosensors shift from personal health tools to public health sentinels. They act like an immune system, not inside one body but across entire populations. Now add AI to the mix. These systems don't just collect data, they analyze it, identify anomalies, and detect trends before humans can. If a region suddenly shows spikes in inflammatory markers, that's a red flag. It could mean a flu outbreak, a COVID resurgence, or a new pathogen we haven't named yet. And because biosensor data is immediate and continuous, it beats traditional reporting by days, sometimes even weeks. And time is everything. Public health systems have always suffered from delay. Someone gets sick, they wait, they go to a doctor. A test is ordered, then results come back. Maybe it gets reported to health authorities. That lag can be fatal in an outbreak. With biosensors, the timeline compresses dramatically. Signals can be detected before anyone realizes they're sick. You're not waiting for hospital beds to fill up. You're spotting the smoke before the fire. This changes how we think about outbreaks. It's no longer just reaction, it's prediction. And the more people who wear biosensors, the better the system gets. Just like Waze gets smarter with more drivers, biosensor networks improve with scale. Every data point adds a resolution. You start to see not just that something is wrong, but exactly where and in what population. Take an example. In 2023, a trial in South Korea used sweat based sensors to track signs of respiratory illness in factory workers. The system flagged anomalies in real time. Within 24 hours, local health teams responded, tested, and confirmed an outbreak. The sensors were faster than symptoms. Another case in California, researchers used biosensor bracelets in retirement homes. The goal was to catch fevers early. What they found was bigger. Subtle changes in temperature and heart rate flagged infections before they spread room to room. Elderly residents got treatment sooner. Life was likely saved. This isn't surveillance in the dystopian sense. These are voluntary, anonymized networks designed to protect, not control. In fact, in regions with weak health infrastructure, biosensors might be the only way to catch outbreaks early. They skip the need for labs or clinics and go straight to the source, the human body. That's why global health organizations are paying attention. The WHO, the Gates Foundation, and others are funding pilot programs to explore biosensor use in vulnerable areas, refugee camps, urban slums, remote villages, places where disease can spread fast and invisibly. And here's the bigger picture. We've spent decades building digital systems to track weather, earthquakes, even cyber attacks. But disease? It still catches us off guard. Biosensors could change that. They are building the foundation for a planetary health radar, one that doesn't just respond to crisis, but anticipates it. Chapter 2: Turning Data into Defense. Collecting biosensor data is only the first step. The real breakthrough comes from what we do with it. Because when you are dealing with millions of data points, heart rates, skin temps, respiration patterns, the challenge isn't the signal, it's the noise. This is where artificial intelligence steps in, not just as a helpful tool, but as the core engine. AI sorts through massive streams of biosensor data in real time, flagging anomalies that humans would miss. Not one off spikes, but subtle, sustained patterns that point to something bigger. You might have a few hundred people in a region whose body temps go up by just half a degree, not enough to set off alarms in a hospital. But if you zoom out, and the AI does, that's not random. It's a hotspot forming. And if you catch that early, you can act early. This flips the traditional model of health defense. We've always waited for symptoms, for clusters, for test results. With biosensor AI systems, we get warnings before the first news headline even breaks. Let's take wastewater analysis. During COVID-19, it became a way to detect viral RNA before cases surged. Now, imagine pairing that kind of population level tracking with personal biosensor data. One tells you something is in the environment, the other tells you it's entering bodies. That overlap creates precision. And it gets even more powerful when different data sources are integrated: climate data, travel patterns, search engine trends, medication purchases. AI can layer biosensor data on top of all that to predict the trajectory of an outbreak, not just where it is, but where it's going. That kind of model can inform decisions before they become urgent. Health agencies could pre-position resources, send mobile testing units, or even issue early advisories based on sensor signals. Think of it like weather forecasting, but for disease. In fact, some countries are already doing this. Singapore has built a real time epidemic dashboard that pulls biosensor data, hospital feeds, and social trends. It uses predictive models to simulate what a flu wave would look like if it hit now, who would be affected, which hospitals would be strained, how long it would last. They treat it like a moving target, adjusting every day. And when the data shifts, so does the response. That's agility. Now, this system doesn't just help governments, it helps frontline workers too. Imagine a nurse in a rural clinic getting alerts that her region is showing a spike in respiratory markers. She can prepare, order supplies, isolate vulnerable patients. She's not blindsided, she's ahead. And for the public, this kind of system could plug into everyday life. Just like we check the weather before going outside, you might check a health heat map before heading to a crowded event. If your city is lighting up in orange, maybe you skip the concert, or maybe you mask up. It gives people choice, informed choice. There's also potential for biosensor AI to spot things we've never seen before. New diseases don't come with labels, but they do leave traces. A cluster of symptoms that doesn't match anything in the database might be dismissed in isolation, but when it's picked up across geographies in different populations, AI starts to ask, what is this? That's the moment early detection becomes early discovery. Of course, none of this works without safeguards. The systems must be transparent, the data must be secure, And the people wearing the sensors need to know exactly how their information is being used. This is especially important when sensors are deployed across borders because health data doesn't stop at checkpoints. If a virus starts in one region, it will spread, which means a truly global system needs cooperation, not just in tech, but in trust. Countries will have to agree on data sharing protocols, privacy standards, emergency triggers, and they'll need to do it fast because the next outbreak won't wait for paperwork. One solution being explored is decentralized health intelligence. Instead of a single central database, biosensor data could live in secure nodes, shared only when a verified pattern is detected. Think of it like a distributed immune system. Each node watches its own region but sends up a flare when danger emerges. This model is already being tested in Europe, where biosensor trials in schools and public spaces use edge computing. The devices process data locally and only share alerts. No names, no personal health histories, just signals. Enough to warn, not enough to harm. And that's key, building systems that are effective without being invasive. Because if people don't trust the system, they won't wear the sensors. And without widespread adoption, the whole model breaks down. But if trust can be earned and the system is built with consent, the benefits are massive. Global health goes from reactive to proactive. Outbreaks are managed like wildfires, spotted early, surrounded fast, and extinguished before they spread. Chapter 3: A New Kind of Global Immunity. Here's the shift we're living through, from fighting outbreaks to preventing them, from relying on slow, centralized health reporting to using live biological signals that turn your body into a data point for global defense. This isn't about replacing doctors, it's about giving them superpowers. When biosensors are embedded into daily life, they become a kind of ambient intelligence, a silent, always on network that listens not to what people say, but to what their bodies reveal. The fever that hasn't been felt yet, the respiratory change before the cough, the trend before the headline. In that way, it mimics the human immune system, quietly scanning, recognizing threats, and triggering responses before damage is done. But instead of cells and antibodies, this global immune system is built from sweat sensors, AI models, anonymized data streams, and digital alerts. And like any immune system, it gets stronger with exposure. Every outbreak, every anomaly, every false alarm trains the system to get smarter. The more it sees, the better it learns to differentiate between normal variation and true threats. It starts to recognize the difference between a post exercise heart rate spike and a sign of systemic illness. This learning doesn't just stay local, it can scale across borders. If a new flu strain appears in Chile and biosensor networks there flag it early, the same systems in Southeast Asia can be primed to watch for the same biomarkers. It becomes a distributed reflex, a shared biological intelligence across geographies. There's precedent for this kind of coordination. We've seen it in how weather satellites work. One sensor sees a disturbance off the coast of West Africa that feeds into global models. A week later, it's a hurricane approaching Florida, and people are prepared. Biosensor systems can do the same, but with viruses instead of storms. That means a virus can't surprise the world anymore, at least not as easily. And that's a major leap because so much of the damage from outbreaks comes not from the virus itself, but from how late we catch it, how slow we are to respond, how chaotic the scramble becomes once the system is overwhelmed. With biosensors, response becomes rhythm. You get the signal, you act. Not with panic, but with precision. Let's also talk about what this means in non pandemic times. Biosensor networks aren't just for headline emergencies. They can help manage seasonal illness, reduce strain on hospitals, and guide local policy decisions. If a city sees a rise in biosensor alerts related to dehydration and heat stress, it could trigger a municipal warning. If a school shows a cluster of mild but consistent gastrointestinal markers, it might prompt sanitation checks or early closures. These are small, local wins. but they add up. And on the personal level, biosensors empower people to care for themselves better. A person might get a real time alert that their body is showing signs of inflammation. It might prompt them to rest, hydrate, or seek help before things get worse. Multiply that by thousands, and you start to reduce the burden on healthcare systems from the ground up. But let's be clear, this future isn't inevitable. It has to be built. It needs investment, standards, interoperability. It needs public education and trust. And most importantly, it needs to serve everyone, not just those in wealthier countries with access to advanced wearables. The power of a global immune system comes from global coverage. A blind spot in one region can become a weak link for everyone. So, part of the challenge ahead is ensuring biosensor access, infrastructure, and policy aren't limited by borders or budgets. There's also a cultural shift required. People need to see biosensors not as invasive tools but as protective ones, like seatbelts, like smoke alarms, tools that feel normal because they keep you safe. That's already happening. Younger generations, especially, are used to wearable tech. The leap from a fitness tracker to a health biosensor isn't big. The key is making the benefits clear and the trade offs fair. Because when this system works, the upside is enormous. Fewer deaths, less economic disruption, a faster, smarter, more humane response to the health threats that will absolutely come again. The last few years taught us that we can't wait. Waiting costs lives, jobs, stability. A global biosensor network offers something we've never had before: the chance to be early, to catch the next crisis before it explodes. This isn't just a health revolution, it's a systems revolution, a fusion of biology, technology, and data into something new, a kind of planetary awareness. It won't be perfect, but it will be better. And better is what we need. Thanks for watching. Check out the references in the description to explore further.